Good evening, everyone. For joining us for this session on UMANG. A little background on UMANG. UMANG, as we all know, is the brainchild of Dr. Gauri Saroj. It was created by like-minded medicos coming together and starting to expand their horizons beyond the limitations of professional learnings to create a different kind of CME. A creative medical evolution through various insightful, inspiring, and interactive online sessions by medicos on non-academic life skills. Across the entire medical spectrum, from medical residents and young doctors to senior-most doctors, public and private sector, doctors from all specialties have been part of this movement in the last 3 years. This is the 37th session of UMANG. And thanks a lot to Gauri for giving us this opportunity to present such an important topic on this forum. Today's topic is the Guru Shishya evolution from traditional to modern. I am Dr. Sonali Saraf, work in Jupiter Hospital as an anesthesiologist, and Dr. Ashish Fadnis, who is an orthopedic surgeon at Jupiter. We are going to moderate this session. Ashish, I hand it over to you to introduce our panelists.
Yeah, thank you very much, Dr. Sonali. And as Dr. Sonali mentioned, UMANG has come really a long way, and this is the 37th episode. So without wasting much time, I should go on to this particular session. So there were a lot of discussion happening amongst us in Jupiter Hospital, outside with our teachers, that we are now getting a DNB program. We are getting students. We are quite well into our teaching curriculum about this topic of, in this modern day, sensibilities and sensitivities of the residents who are coming, the Gen Z or the next generation which is coming, the way we train, the way they are training, the availability of resources, knowledge and guidance on social media platforms, and which is readily available. The shift from printed books to a experience based guidance, training, apprenticeship, or whatever it's called. The move has been towards what is evidence based, what is available on YouTube or on certain apps which are training them. So where do we stand as a guru shishya, or as a teacher student, or a mentor mentee relationship? So this is the reason why we decided to have this thing today. And I'm very fortunate that Dr. Gauri and her team of UMANG, along with Dr. Ravi and everyone else, has decided to invite our senior teachers. So I'll begin by introducing Dr. Indrani Hemant Kumar, who is an ex-head of the Department of Anesthesiology at KM. And I heard a lot of good things from you, madam, from Sonali, when we were discussing about this. And Dr. Indrani Hemant Kumar, she will bring her experiences of being the head of the department and training so many students in KM over the years. Next we have is Dr. Nandini Chatterjee, who is a professor of medicine from IPGMER in Kolkata. Madam, welcome to this session, and we are very eager to hear from you, coming from Kolkata, which has been sort of in the news, and we have everyone had their eyes towards Bengal over the last few months. But yes, we do have really good trainees coming from there who come to Bombay. Bombay trainees go to Kolkata. So we know that the ethics of education and impartment of knowledge is ingrained in Kolkata as a great center of training for surgical and medical specialties. It gives me immense pleasure to introduce Dr. S.K. Mathur, who has been a very senior member of the surgical fraternity in Bombay. He has been a professor of general surgery and GI surgery in St. G.S. Medical College, a professor and head Department of General Surgery at Nair Hospital, and currently the president of Zonal ZTCC. He is a member of the task force on organ transplant to the Government of India, and he is a member of advisory board of Government of Maharashtra for TOTA, the founder member of MCFOT and ZTCC in Mumbai. It gives me great pleasure to be with you, sir, again, and I think probably it's the third time that I'm going to be with you on a sort of on a similar platform of UMANG. Welcome, sir. And lastly, my dear friend, Dr. Girish Bakshi, who is not only a senior, but interestingly has also been a mentor to me during my MBBS days. Girish is a year senior to us, and we have sort of constantly referred to Girish as the scholar and approaching him for a lot of doubts we had during our MBBS days. So yes, I know Girish as a senior resident as well. So Girish is a teacher in Grand Medical College, a professor of general surgery. Welcome, Dr. Girish Bakshi, and we look forward to hearing from all of you. To begin the proceedings, I would like to, each one of you to sort of make an opening statement or an opening comment on what you see is the current status of the Guru Shishya relationship we have in the background of whatever we just heard or I just mentioned. We can start with Dr. Indrani Hemant Kumar, ma'am, please.
Yeah. Good evening, everybody. So the current status of Guru Sishya relationship, what I would say is, people are realizing that the connect which a Guru and a Sishya had, that connection has slowly has started missing. So people have realized that, and now even the university curriculum is trying to get the Guru and the Sishya together. So we in the present curriculum, we have this mentor-mentee kind of connect which has been added to the curriculum. And so we hope, from the time, we have seen the transition from the time we were students to how the students were there some time back. And now that we know what was missing between a Guru and Sishya, now people are making amends. And, now the Guru Sishya hopefully should get back to something which is like in between, which would probably, blend the best of both, teaching. The kind of teaching which was there before, holistic kind of teaching, to a more pointed kind of teaching which is there presently. Dr. Ashish, you're muted. You're muted. How come everybody's muted?
Ravi, if you can unmute Professor Nandini Chatterjee,
We are
please.
heard.
And
Ashish, we are heard.
yeah.
Yeah. Now we can hear.
Yeah. Nandini ma'am, you
I'll
want to say something about this?
Is actually the concept of the Guru Shishya Parampara is eternal for the days of Arjuna and Dronacharya. But in the modern day, what is happening is that with the onslaught of technology and AI, we are heading towards a different direction. We are driving each other further away. So gone are the days when the only source of knowledge was the dim lit library with racks full of books, and the teacher who was percussing and palpating and showing us how to examine a patient and come to a diagnosis. So students are more in front of their tabs or laptops. So it is high time that we look into this and bring about a synergy between the traditional and the modern. We cannot go back to the days of the Vedas. It's impossible. We have to inculcate the modern things into our education system, but we also shouldn't lose the connection with our students, because primarily we are doctors and we deal with human lives. So the element of empathy can only come when the experienced can give that wisdom to the newly inculcated. So that is what we will be discussing today, and let's see what it brings on.
Thank you, ma'am. Yeah, Girish, can we have Ravi? Can you unmute Girish or Dr. S.K. Mathur, please?
I think Mathu sir is senior. Mathu sir should be speaking first. So Mathu
Excellent.
sir should be
Okay.
No, Greece, my rule was the junior most speaks first.
Sir's rounds, sir has been a mentor for all of us and his rounds, how Guru Shishya Parampara, and we really learnt a lot, punctuality from our teachers. I remember last Saturday when I had gone to Roy Patinkar sir's CME, sir was much before, that punctuality, they lead by example. These are the mentors, like our teachers. What I feel is that now, as Indrani Madam talked about the new CBME course, rather than becoming teachers, we are more like facilitators because the basics of adult education is changing. Moreover, with the digital world, as Professor Nandini talked about the availability of laptops, tabs to them, everything is easily available. Google it, and they know a lot. But at the same time, because I have been teaching since last 25 years, I am as faculty in government medical college. What I realized is that our teachers like Mathur sir, Bapat sir, and all other teachers have taught us so many clinical skills, which unfortunately in today's era, we are not seeing them developing in our young resident students. And perhaps we were taught that an investigation is done to confirm the diagnosis, what you have priorly made from your clinical history taking examination. And that was something which I think, which is a great armamentarium in our hand, both physicians, surgeons, whatsoever, in which field you are. But that is not being picked up by the recent students. Maybe we are at fault, teachers, maybe we are not giving them much time, or maybe the curriculum is designed as such that as we are talking that we are not teachers, we are facilitators, if you see the recent guidelines of the NMC also. And that I think it should be a relationship between like a friendship, a facilitator, and at some time you have to be strict like a teacher. That is what my take on this is. And I think Mathu sir is there, so I'm waiting to hear from him because he has been our teacher, so he will be able to give a better. Sir, please.
Yeah. So let me put it this way, after listening to all three of you, okay, that I will look at my own life as a teacher when I was a conventional teacher, and I teach still today, though not those who are my PG student, they are others PG student, but I'm involved in their training and teaching. And have I changed my methodology? Not really. So what Girish was saying, that the teaching war rounds, it has got converted because in private sector, you can't take the teaching war rounds. Is like when I'm seeing a patient in the OPD and the resident is with me, okay? He learns how I'm taking the history, how I'm talking to the family, and how I'm then analyzing or doing the physical examination and this thing and going into the, because patient these days comes with the multiple files, and how I avoid looking at the files till I have talked to the patient and taken the full history. So it takes me almost 1.5 hours to get through one patient. Okay. So I think important thing is that whatever you do as a teacher, I'm talking as a teacher, not a mentor. So I distinguish between the two, and I'll just explain to you. So as a teacher, you are imparting the skills to the students, which they don't have. Okay. Which starts from, as we know that all, whatever our clinical science, it start from the history taking interrogation and the physical examination and everything. So it involves all that. Now, I used to do at that time, Girish, you remember that, means house has taken the history, undergraduate has taken the history, and I will still on the round ask few questions to the patient, and suddenly the house and registrar will look at me, this patient didn't tell us all these things which he's telling you. No. So that's the way. But then the others learn how I put the question to get that information. So same thing So you don't have to change. That's the teaching part is concerned. Because you have to teach by an example. The students of current generation will understand, oh, this is the way it is to be done. You don't have to tell them to elicit this physical science like this and that. That they can read in the books. The mentorship part is concerned. Now, mentorship goes beyond that teaching. It involves that you may guide somebody for the career. Like at undergraduate level, somebody may come that should I take the surgery or should I take the gynae? Particularly, it happens for the female students, okay? And or they should go into this branch or that branch where you can be a mentor to guide them. Okay, what are your goals? What you want to, and what's the background you want to, what you want in the life. Second thing is when it comes to choice of careers, when you are doing the post-graduation, sometimes it happens whether you get an option. And I'll give the example of one of my students who did MS surgery. And he had the option of joining as a faculty at Tata Memorial Hospital versus going to Kolhapur to settle down this. So then when you give the advice, that is a mentorship. That becomes a mentorship. And that's where you should give the guidance. I will elaborate on those examples for subsequently as we proceed.
Excellent. Thank you, sir. So, I mean, I just will take on that last point which you mentioned that, you have not changed your teaching. Now, I would like to ask the entire panel, I mean, with you, starting with you, sir, that nowadays with the all India entrances and the postgraduate exams, so what we are seeing, which was not there during our residency 20 years ago, is that there is a lot of mixture of residents from diverse backgrounds. For example, a person from Maharashtra might go to Kolkata or Northeast and get a postgraduate training, or person from South would come to Bombay. Uh, does that pose a challenge for you to impart? Because they come from different mindsets, they come from different medical colleges where the culture has been slightly different to the culture that you have been, or as a person, you have been using those techniques to, teach them. So how do you tackle that? Because we have trained in Bombay. I am from Bombay, and I get a student, let's say, coming from Haryana or Punjab.
So as far as as a teacher, our methodology should not be region specific. Okay, it is a subject specific and a student specific. It makes no difference from where the patient comes, the student comes, whether he is coming from Tamil Nadu or Kerala or West Bengal or Bihar. I've treated all of them the same way, that this is the way I work, this is the way I teach, this is the way I expect from you, and you have to do this way. Because in my experience and opinion, this is the best way for you to learn.
Right, because I mean, this is also the background of what Dr. Leena Jain has mentioned in the chat, that that she, in her experience, in spite of assigning a mentor to a mentee, the students will still talk to someone who they feel comfortable with. And I think one of the things, sorry, Dr. Indrani, you want to say something? Ekman Ravi, I think you'll have to allow us, some of the panelists to unmute themselves.
Okay. We as teachers have come across a lot of students who come from different states.
Yeah.
And to tell you very frankly, when they join our institutes, there is a lot of, they are missing their parents, they are missing their friends. It's a new place. The kind of accommodation which our hospitals give is pathetic. They have to share, 4 or 5 of them have to share a hostel. I mean, they don't have basic things with them because they can only bring 1 or 2 suitcases. I mean, there are a lot of issues when they join. And at least I can speak for myself, and I'm sure Sonali will agree with me. When a student is given to me, I take a meeting of these students one-to-one, and I try to understand their background, including their financial background. And then I tell them that you are right now here You've come here to study. You have to concentrate on studies. That is one thing. But remember, studying is not everything. If you have any problem, it could be anything, including financial, whatever it is, you should understand that there is this person who is always, who's going to look after you. In the absence of your mother, I am your mother now. So I always tell my students that I am your mother. And not only that, I invite them home. I give them food. I take them out for tea and coffee. I chat with them. So I do all this in the beginning with them. And even later on, once a year, I always bring them home. So it's like, this. So this is something which I understood from the students, because I know there are a lot of students who mentally break down, who cry. There are a lot of issues when they join. But after they cross 6 to 8 months, they are all like, settled. They're all settled. But first few months are difficult for them. They are difficult.
Thank you.
I mean,
Thank you. Thanks for
I
bringing that up.
agree with madam. It's a very deeply personal thing that goes on. Why even out of station students, even with the students which are there, even in Mumbai, that is the bond we are used to.
Yes.
Yeah, Ashish.
Yeah, no, I was just to tell madam that, funnily enough, you touched upon that topic. That was exactly the question that we had decided to ask you, that, the traditional reverence a student is to have towards his postgraduate guide. And is there a need for a personal mentor? I think you have alluded to this topic as well. So, I mean, we can move on to the next question, Sonali. I mean, if you want to address.
Yeah, so Nandini, I wanted to ask you a role of mentor. Actually, how do you envision in this AI-driven, there are so many means and modes available for students to gain knowledge from. Is there a role of mentor actually needed, and how would you do it in a changing scenario like this? And how do you
Yes.
influence your students, right, to go to your way of, learning?
Yes, this is a very important thing that you have asked. And it is, I think, the most difficult part a teacher has to go through, because it is not easy to be a mentor. Two things I will refer to. One, Indrani ma'am, what she was referring as what she is being doing, that is what a mentor should be like. A mentor is not one who just teaches medicine to the students. A mentor should be someone to whom the student can come up with, not only related to the education part, but also for personal growth and challenges. Another thing that Mathur sir was also saying, that doing it by example. That is, you can only be a mentor if you yourself set out that example in your own work ethics. I cannot preach something and then not do it, because everybody is a grown up. Our students are not children, they are grown ups, they are adults, and they are very intelligent people. So if I do not myself abide by what I am preaching, it will be of no use. So mentorship not only encompasses giving information to my students, it is guiding them and supporting them, making them realize their own strengths and weaknesses. First thing is that. And then also telling them that what opportunities that they can avail in their own personalized way. And also being a support for certain challenges like mental health problems, for which confidentiality and an element of trust is very important. Unless your student trusts you fully, he or she will not open up. So mentorship is very easy to discuss maybe on a platform, but it is extremely difficult to really do it in our everyday practice with the students. Regarding the AI and the technology that has sort of infiltrated into all our lives, students may feel that I don't need to go to the teacher to know things. I have everything at my own fingertips and I can do it. So it is my job to make them understand that there are certain things beyond what is written in the Google. Things like how I speak to my patient, how I break bad news, how I document various things in my rounds, because something may happen and a legal case may come up. And what is the importance of documentation? These small things, they come with experience. And I have made mistakes in my life, and I will tell my students that you people don't make these mistakes. So that is how I think a mentor should be.
And also, like how Dr. Girish Bakshi said, they handhold you and say, "Oh, come on, you focus over here. You do it. You auscultate over here." They handhold you and teach you. I mean, that you won't get it on AI.
Absolutely. So, change is not always bad, right? Change can provoke us into thinking that, yes, we can offload some of the bits and pieces to the AI, but the core values or the soft skills do not change. Ashish, you want to take over?
Yeah, so I mean, good that we brought out this point about AI and trust and openness. So Girish, you heard both of them talking about having that personal mentor sort of relationship, and residency is like an apprenticeship. You watch your teachers and then you imbibe from them. So in this current sort of sensitive medical legal scenario that you have, or very sensitive resident groups we have, there are certain people who can be offended by certain statements, certain people are having different sensibilities. So medical legally, where does a teacher student relationship stand as of today in a government setup or a corporate setup? How can you maintain openness? How much can you offload to the student? How much responsibilities can you give while trying to teach him also?
See, as far as medical legal things are concerned, you know that initially as you have to develop that bond with the student. Normally what I do is that after my rounds, what we do is I talk to each and every patient's relative regarding poor prognosis, if it is good prognosis, what is the nature of the injury and this thing. And the same thing I tell my residents, residents that in the evening round, what the condition is, you should be talking to your this thing. So this is one thing which is there. Second thing is that you also have to look at the mental makeup of your students, how strong they are, because you come to know, because some people, we get a lot of people because they are coming from out of state. Obviously, as madam talked about the residency and the uh, hostel rooms not available, you'll be surprised that because of the sudden surge in the seats, postgraduate seats, the competition is not there, and these people are put up in even in the side room of the wards, and obviously that also takes a toll on their mental mental health. So many a times we have to counsel them, we have to talk to them, and it is on individual one-to-one basis. That is something like many times they have not eaten breakfast. So what we do is JR2 is responsible for JR1's breakfast, JR2 is JR2's breakfast, JR3 has to take care, and if JR3 has not taken, lecturer is responsible, and if lecturer has not taken,
Boss
I'm
will do it.
responsible. So because they are not eating well, all these things are there. And as far as if you talk about these medical legal, as far as documentation is concerned, you have to sit with them for the first time, talk to them what is required. And if you talk about between a case between a student and a teacher, it only comes if you know if you have talked very foully and if you have not understood the other side. Long time back, if there was a case in a municipal hospital where where the student had alleged that the teacher had harassed. So there was already an inquiry and all those things. So this is something which is coming up now. But as a teacher nowadays, what we used to listen from our bosses and we used to say, "Nahi, that it's fine. He's our teacher." That thing has gone now. So when you're talking to your students, you have to take a pinch of salt that you can't behave like how your teachers have talked to you, because I will give you a simple example is that in our school time, if some teacher used to tell us something, and if we come home, our parents will say, "Okay, nahi, it must have been your fault." Now it is reversed. Now, if the student comes home and tells that, okay, there is something, my teacher, and the parents are ready to pounce upon teachers. So, this is the difference. This is the change in mentality which has occurred. And that is why this is a very delicate thread on which you have to really take into account the student's background, and madam talked about what is their mental makeup, how they are living. And obviously, if they're done a whole emergency, and after that, you are harassing them again by asking some silly question, that is something which you will have to take into account. At our time, we were, I think, mentally little bit stronger than the present generation. That is what I feel. I don't know, I may be wrong, but I think the more tougher times you face, the more tough you become. You are able to endure that much. That's what I feel. So
I think Dr. Mathur will tell us how tough we were as compared to the people now.
no.
He must have.
Sir's round was grand round. We always used to look up to it. And, it's single thing. You learn how your teacher is thinking. That is something like why is he asking that only question? As sir told that sir had taken history, we have represented history. And then sir will ask something which we have not thought about it also. And that is because he wants to tell us that what is the importance of this thing. So that I think some things that is required also.
So, are you coming across examples where there have been medical legal issues the boss is facing because of some lack of breakdown of communication between him and a resident or so?
Yes, we are coming across such cases very frequently. And there is an inquiry, we sit with the student, we talk to the teacher. That एक ये है ना, रहीमन धागा प्रेम का मत तोड़ो तिचकाए, जोड़े से फिर ना जुड़े, जुड़े तो गांठी पड़ जाए. मतलब that once that happens now, then we won't be able to maintain that relationship between that student and that mentor. That is something which I feel.
Yeah. Can I come in here?
Yes, please, sir. Yes, sir. Yes, sir.
See, what Grish was saying, see, I face this. See, we all, in our career, sometimes it happens that you fire a resident or for wrong reasons. It has happened. Okay. And I learned from my teacher that if you realize that you have fired somebody for wrong reason, because sometimes it happens between the registrar, houseman, somebody plays smart and puts blame on the others. At that time, that person comes in the firing line while he is not at the fault. Once you realize that, you should go back or call him and say sorry. I have done that. And that much courage you should have. Then you have a right to fire anybody.
So
Okay.
openness goes both ways, sir, as you're saying. Being open
Yeah,
about the mistake that even we make as a teacher is as important as a mentee saying sorry for the things that they have not done.
Yeah, true. See, both ways, but they learn from you. If you have a courage to say sorry to your house surgeon, that he learns from the life that yes, I can also do the same thing. He will do the same thing afterwards. And second thing, what Indrani was talking about, how to make them comfortable. Girish knows that I was a terror in the awards. Okay, I will accept that. I accept that. Okay. Now, I have this rule of dress code in the wards. Okay. Which was even, so, which is a very contentious issue.
Hmm.
Right.
Okay. In my ward, no undergraduate student could dare to enter in the chappals or the jeans or the t-shirts. Okay, I didn't insist on tie because I also didn't wear the tie because our weather doesn't allow. But trouser, shirt, and proper shoes. And this was a rule even for my residents and undergraduates. And the way I used to convince the undergraduate students, because you can't just force the discipline. And if you look at and I used to get the example, you watch the English movies. Who wears the jeans? I'm not talking about the today's world, but at that time, who wear the jeans? And that is a labor class.
Laborers.
Laborers. Jeans was meant for them. Amanka, you are going to be a doctor, not the laborer. And the patient has to respect you. So if you are dressed up properly, patient will respect. And that's all true also today also. See, a lot of things which happen in the hospitals because the people are not dressed up properly, they don't look like a doctor, they look like even the ward boys wear the same type of dress which the doctor is wearing. So once I convinced on the day one, which I used to take the class, of course, my resident always conveyed to the undergraduate, okay, this is the way, if you are posted in this unit, you have to behave like this. But they all followed. And after many years, when I got their messages, they are all consultants now, okay? And they mentioned that thing and they said that actually it was a good thing for us because we learned that thing and we follow it now. So, so you have to set the examples and explain to them why it is required.
I mean, that,
Actually,
yeah,
yes.
yeah, ma'am, you were saying.
Yes, what I'm saying is that what we see in our students is also a reflection of society in general. Like when we were young, I am sounding like an old person only, but we were very afraid of our teachers. Like we wouldn't dare speak with them so much one to one. If somebody is saying that you do this, I wouldn't dare answer him because that was the culture at that time. But now, it may so happen that the student may be conversing with me as if I am a friend. Well, that is not bad, that is good. But sometimes it becomes difficult when I have to impose some disciplinary something which I do not like about him or her. What sir is saying that I have told my students that they should have a dress code. But in order to implement that, I need to have a distance from the group of students. They are not my yar. But then the new curriculum also says that we need to become closer to them. We need to bring them under our wings and discuss with them their concerns and challenges. So it is very difficult to bring a balance between this. How I can maintain a distance with my student and how still I can be close enough so that they can open up to me. So I think it's a very fine line. And with experience, even the teacher learns. Just as the student learns, the teacher goes on learning how to deal with these things.
So I'm going to ask each one of you a few examples actually from real life. You may say, let's start with Mathur sir. Sir, in the days when students used to actually fear you and used to obey you blindly, we see the number students now questioning you on your judgment. How have you changed, or you have not changed your approach at all during this? And just give us some real life examples of the old school and the new school of the students that have been, going through your hand.
So I will tell you one thing. I was a teacher at that time also, what I am today. And that time also, I used to encourage my students to ask questions. I never discourage them from asking the question. As a matter of fact, I always say students are the best, your best teacher. Why? Because when they raise the query, see, we are not all knowledge all the time available to us, or we have read something. So I used to say that, okay, I don't have an answer. Why don't you go and look into it in the library at that time? And today I tell them to consult Google. I encourage them to do it. And I also look into it. And then my duty is to explain to them. See, the thing is that knowledge is available, which you can acquire from everywhere. But how to use that knowledge judiciously is the mentor's or the teacher's job. In a given case, how in a given situation, how will you use this? So I always encourage the questioning, right? Even at that time. So I was a little different from though I was strict, but still I wanted them to ask the question. As a matter of fact, in a surgery, I always say A good assistant is one who questions his teacher, why you are doing this? Why not this way? And I should be able to explain to him. Because sometimes you realize that you are going to make a big mistake if not pointed out by your assistant. So rather than getting irritated on the assistant for that, you should be thankful to him. So that mindset the teacher has to have, that openness has to have, that you can be questioned, and if you don't know the answer, you flatly accept that, yes, I don't know this. Let's both go and look into, if we can find the answer, then I will also like to explain to you.
Madam, you want to share some examples with us, Indrani Madam?
Uh, I think what Dr. Mathur said was very right, you know. So, you should be open with them. You should be approachable. So they should be able to feel comfortable asking you questions, you know. So I have had, students who have asked me, Madam, don't you think we should give, combined spinal epidural to this patient? Because, because I was planning only a spinal anesthesia for them. And should we add this to the spinal, drug? Should we add this? So when they come out with, when they come out with suggestions, and as a teacher, I might not have probably thought about it, and I would openly accept it. And if I don't accept their suggestion, then I would give them reasons why I do not want to accept it, why I'm going ahead with what I'm doing. So I think as a student, as Dr. Mathur very rightly said, you have to be very approachable, and, you have to be open. And the student should have that confidence in your teacher that, they can uh, talk to you in a free way, in very freely. At the same time, maintaining respect. What I would say is, no student will be a yar to you. Definitely. No. They also know their, limitations. They also know how much they can joke with you. They also know what they have to talk to you. They also know their limitations. And we also know how much we can go, to what extent we can go to them. At different points, we go to different levels. Supposing you have a student who is, who's having mental issues, we go a step forward, we bend backwards for them, So we do not go to that personal level to another student who's mentally strong, So it's like each student, it's a different, different approach, I would say.
So many people in the chat box are actually agreeing with what Mathur sir has said in his settings, and it could be a double-edged sword. But if, as Indrani Madam said, there is a certain amount of distance which is maintained, and students are smart enough to gauge that part of it. Dr. Bakshi, on to you. Anything you would like to add to this?
I think my thoughts echo with what Indrani Madam and Mathur sir said, talked about, because there has to be a certain distance. At the same time, you're close to them also, so that they know to what level they can joke with you, what level you can joke with you. It's a give and take relationship. Respect is always mutual, but when you're teaching something, that time the respect has to be there for you. However, when there is some other calamity on their side, which maybe social, financial, family, at that time we go down to their level. That is different. Like in the wards, I always say wards, there is something that I'm your teacher, and I'm the person who is responsible for all the patients. Even whether you are doing good or whether it is bad, it is reflected on me only. So I am responsible for all the patients. And when we go out of the ward, at that time, we are just talking about, okay, this is happening, what is happening at the home front. So that is a total different thing. That is something which you should make them comfortable so they can come out, they can talk to you, they can clear their doubts. At the same time, they also know a limitation, like you cannot be yar, as madam said, that something like that. You can be their friend, you can be their mentor, you can be a senior, you can be their elder brother or fatherly figure. But at the same time, it should not go down to, like nowadays I see some of the young teachers and their students smoking together, which I unfortunately never, I've not been brought up in that culture. So you know that we have seen people who, when they see the teacher in the campus, they will not even touch that cigarette also. So that is still that is something which has to be there. I feel that is something which should be followed.
Dr. Bakshi, that's what I wanted to say. They know their limitations. So when you're in the hospital, when you're amongst in a professional environment, the way they talk to you, the way they interact with you is different. When you take them out to a hotel and sit in the table, you should see the way they rag each other and they may, crack jokes and, and we are also part of that.
Yeah, madam.
So at every stage, I mean, I would say that, at different levels, the interaction is always different, I would say, and also with each student, it is the individual need of that student and the teacher. You understood, no? So with each student, it is a different kind of an interaction.
It has to be customized.
Not like same interaction to all students.
It cannot be. It has to be
always different.
Nandini,
One will need little more motherly love. One will need, a sturdy, a warning. One will need, so it's always different.
Yes, I agree, madam, because it has to be customized according to the student.
Yes.
Each student has their own mental makeup. They come from a different background. So it is always like they are adjusting, we also have to adjust. It is something like this.
Absolutely.
Nandini, you wanted to add something?
No, I
Yeah.
was, sorry. Please go on.
Yes.
No,
You
no,
were
ma'am,
saying
please go on. No, I was just going to say that you wanted to add something here.
No, there's nothing to add. Actually, I'm absolutely in agreement with Indrani ma'am and Bakshi sir. That even I've been teaching for the last 20 years, and we have come across different students who are some are naughty, some are very respectful, some are very weak, some have gone through sorrows in their lives, and we as their teachers have to, because when especially the postgraduates, in the undergraduate students there are so many in number that we often do not have that one-to-one interaction with all of them, but postgraduate student numbers, especially in our institutions, they are less. So in one unit maybe there are 3-4 residents and we are very close to them and we know everything what is happening. Like even today, actually, one of my students, he got that chicken pox. So he called me and said, madam, I've got a blister and I think I've got to, just before the thing. So this is very important. So I would also like to share, I have a friend, Dr. Sunita Singh. She's my classmate and I think Sonali knows her too. And her daughter is Rashi. So I just told her, ki, tell your daughter to contact me and say ki, what the student is thinking about the teacher. So she just wrote to me 1 or 2 things, and one of them was about the use of PowerPoint. So I'm just taking this opportunity, and she has quite a lot to complain that when the teacher is using the PowerPoint to teach, so many a teacher are just reading out the slides from line 1 to line 10, and it takes away their attention. So they are saying the chalk and talk days were better. Even the student is saying that. So we would have more connection with the teacher when they are teaching with the chalk and talk and explaining to us some issue, rather than just reading out some slides and after 5 minutes all of us are falling asleep. So this is just one thing that she wrote, and I like to share it this year. So we will be having the student viewpoint in some other way, and I know that a lot of things will be coming up. This is for Shonali. A lot of things.
Right. So, I mean, I would like to ask all of you. I mean, so this is we are talking about good things between a mentor mentee, and that all of us are living have geographical space where there is a space for a joke and a space for a friend and a space for this thing. I mean, what would you do, or what your reaction would be? How would you deal with a situation where some of your peers or some of your colleagues are having a breakdown in the mentor mentee or a guru shishya relationship? You have a very dear colleague, but there is something going wrong between, let's say, his student is not happy with the way things are functioning in his unit. He is a different unit, a different teacher student. Where should he intervene? Should you intervene? How would you tackle such a situation? I mean, you can start with Indrani ma'am or Mathur sir also. I mean, you must have faced numerous such things where, just like Dr. Leena Jain asked the question, that student will go and open up with someone else. Someone else identifies, oh, I should go to Dr. Mathur and complain that, my boss is harassing me. Or, he might not be harassing, but he's just not taking in the right way.
You're asking
Yeah.
me?
Yeah, go ahead.
Well,
Go ahead.
all of you, the entire panel. I
Nyan,
mean, you
go
can
ahead.
start with
Dr.
anyone.
Mathur, you
Okay,
want
Nyan,
to
go ahead.
answer this?
Okay, Nyan, go ahead, please.
Okay. Okay. So it's not new that, when you're heading a department, you will find certain students coming and complaining about some teacher. May not be their own mentor, but another teacher. It is possible. So, what I would actually do is I will definitely call the teacher and go straight on that question, on that point where, they have had an issue. So the thing is, you have to listen to both sides, right? So on one side, we will never give up the teacher's reputation. That is one thing where we will keep the reputation intact. At the same time, when you talk to the mentee, you talk in such a way that, okay, this is what you have done, and this is the response you got from the mentor. And henceforth, if you have any such issue, you please come to me straight. You should not talk to that mentor the way you have spoken. So that is a straight answer. And remember, and another thing which I do is, when the patients come, when I see them for the first time, I give them a list of do's and don'ts. And in that, what I tell them is, if you have, I may not be your direct teacher, I may not be doing your thesis. But remember, if you have any issue, you should walk into my office. And if you're not comfortable with me, you please go to anyone in the department who will be of help to you. If you're not comfortable with me, go to anyone else. But you have to go. So that is what I tell my students. So if there is an issue with another mentor, on one hand, I will ensure that, that the respectability is maintained. That I will see, because at all cost, and if the mentor is really wrong, then of course, then I call them separately, and then, probably explain what should have been done, what could have been done. That would have been my approach.
So, Girish, you are mentioning about an NMC laying down certain guidelines. So, are there any such directives from the teaching bodies or the bodies that, this is how it should be, complaint mechanism or grievance says for the teacher and the student both?
See, what NMC has given is that there should be like something like a foster for parent or something from another department, you can be, or from the same department, who is not the guide of the student. Separate from the guide, there should be some mentor with whom they can discuss something if they have any. That mentor will be taking into account their personal information. They have a meeting at least once in 2 months, and all these things are there. But if you consider the PG seats have increased exponentially in the last 3 years. In fact, we have a PG strength of 32 postgraduate seats in MS General Surgery in 1 year. So now it is 96. So you can understand it's a full 100 block, that like a undergraduate class. So In a single unit, there are about now 8 to 10 residents you may be getting sometimes. So that is something which is there. But like NMC, the way they have increased the size, the number of faculty have not increased like.
Or increase.
And coming to your question that they have also, NMC has also told if there is a grievance, they can report it to the dean. There is a grievance cell which is also addressed. This is headed by the warden of the postgraduate hostel, that is the RMO hostel. And there are 2, 3 people where they can complain also. So this is there is a grievance cell as per NMC which we have to make. And this foster guide or foster parent, something like that, which should be from some other departments, so with which the student can open up and talk to them.
Yeah,
This is
see, this is all a student-centric one. But does the teacher have any say in pointing out? Let's say, you're not a demanding boss, you're a reasonable boss, but then you have the not one of the best residents. You can find out that there is a problem, scooting off from work, offloading his work to someone else, and this is definitely a problem. So is there a grievance mechanism for the teacher to point out to someone that see, we are training someone, but he's clearly not the best surgeon in making.
See, now what happens is that NMC told them to write a logbook with reflections. Now, if in reflections, if the teacher writes something bad, then he's also questioned. That is something. At the same time, the behavior changes between, obviously, the teacher will not be that happy. The student may be thinking he's partial. And in surgical branches, what happens is that if you feel that the student is not confident, you may not allow him to independently operate. That is something which is there, because so this student may just go and complain to HOD or to higher authorities that I'm not. So where teachers don't have say, but if you maintain a record, unfortunately, we don't give it in writing. Many times we are told that we should give them in writing the warning or whatsoever you want to do that. But, majority of us don't resort to that because we don't want that. We should put it anything in the writing. It's a career. Ultimately, they are like our younger brothers, students, children. So obviously that we don't take into this thing. But NMC has written that you should write it down in the reflections. Their progress to the next term may be delayed by that. But I don't think any of the teachers will go down to that level where we write it down. And as you said, there is no grievance cell for the teacher. So obviously it is always student-centric now what you are looking at.
Mathu, sir?
Yeah. So basically, if there is junior, and sometimes it happens in the unit, the second in command, some people don't like him, and they may come and say that, sir, he's not treating us well and all that thing. So there are 2 ways we look into it. What is the problem? First thing is to explain to that boy or the girl why something might have been told to him or her in a particular way. And at the same time, your second command or in the department, how everybody is. Most of the time, you get the idea. And then in that case, you have to play it very diplomatically to convey to the seniors also, see, this is not the way to do it. And also to junior to say that this is the way you have to behave. This part is expected of you and you must do it. Regarding this, what Greece said about all house and registrars cannot have same surgical skills. Okay, we also didn't have it. Okay, it's true for us also. Now, if the registrar or the lecturer says that this man is not picking up, in that case, what I used to do is that I used to usually assist myself or show him the surgery myself. Used to start with hernia hydrocele itself, minor most surgeries, and will make him do under my supervision so that he improves. So that's another way of doing the mentorship. Because ultimately you want, because the person has to become a surgeon, he has to become a safe surgeon. He has to treat the patient. You can't say, oh, you can't learn and go away. No, that attitude as a teacher, we can't have. That's
you take the onus on yourself to ensure that that person turns out to be good.
Dr. Fadnes, I'll give you an example.
Yes, ma'am.
During COVID time, you remember we had to manage ICUs, right?
Right.
So the policy was to post 2 residents and 1 lecturer in one
Yes.
ICU. Means we converted what 5 into 36 bedded ICU, you know. So 3 people at one shift. So then after some time, I get a resident who came to me and saying that, ma'am, I thought I should not be telling you, but I have to tell you because it is really stressing us out. The lecturer who's posted over there does not change, is only sitting outside and, just giving instructions from outside. So we have to take care. We have to do all the 36 patients by ourselves. So now you tell me, now this is a resident who's talking about a lecturer complaining. So then this is how, so then here you have to pull up the lecturer. You have no choice. When the point I want to get across to you is, it all depends upon what the situation is all about. There could be liars, you can have a liar also, from student trying to just, take on a teacher. So you have to look at all sides. You have to have a bird's eye view and then deal with the problem,
So, Ashish, I think it's time that, we are coming towards the end of the session.
Sonali, I feel you have to have one question on mental issues.
Yeah,
Because as
I mean,
teachers,
somebody,
it
that is
is
what Dr.
something which
Neena
all
has
of us.
asked in the chat box about the increasing addictions and within the student facility. How do you take care of that? And with that goes mental health issues as well. So does NMC have any guidelines as to for reporting or treatment or confidentiality of certain things that go on within the this thing, so as to save somebody's career and yet not allow any harm to fall on a patient if such behaviors are noticed? So, Dr. Bakshi, Indrani madam, Nandini madam, you're free to comment on this about addictions, increasing addictions or mental health
NMC
issues.
doesn't give any direct guidelines regarding the addictions, but what we have seen is we had examples where some students were having certain addictions. So we talked to our psychiatry colleagues, we talked to them, we got their parents involved. Unfortunately, their parents were not knowing, so we got their parents involved. In fact, in one of the cases, we told the parent to stay with. We even provided accommodation, so they stay with him till his this de-addiction procedure is done. So that is something which you have to do at one-to-one level, because there are no clear-cut guidelines, and obviously we don't want to spoil the career of our person who has got an MS after working so much hard and clearing that PG need. And if he has addiction, that should not be one thing which should take his career back. So we have had instances where people had addictions, but luckily for us, we talk to their parents, we involve them. Initially, parents don't agree because many of them they don't know because they have been in MBBS also in hostels. So unfortunately, they were not knowing. But when they come to know, we talk to them, and then things are sorted out, and it is better to be sorted out at one-to-one level. That is what I feel. There are no guidelines as such, and but this is how we dealt with. This is practical experience in the last I think 8 years. We had about 3 or 4 students like this who had addictions, and they wanted to really it was their commitment also to come out of it. It is not that we were, and their parents and their family support was a lot. In fact, and we had very good psychiatric consultants who really worked with them, and that is something which helped us to tie over the crisis. But there are no guidelines as such.
Yeah, absolutely. Sonali, being an anesthesia, you know how students can easily get ketamine, easily get fentanyl. So I have had my own, some students, at least I can talk about 3 of them in my entire career who got addicted, And as Dr. Bakshi said, we involve the parent, we involve psychiatrists, and de-addiction centers are available in Pune. So I used to give them attendance and I used to send them over there for 1 month. And I used to get feedback from there and then get them back after 1 month. Then they are not allowed to stay alone. They will stay with peers, means some of the other residents whom they are comfortable with. And these residents will give me feedback about how the student is coping, and whether the student actually has come out of it. So, so I this is how, we deal with such students. So just be supportive. And if you're just a little bit supportive, they definitely come out. I can swear and tell you that. And to this day, these are the same people who came on my last day of retirement and spoke openly about it. And remember, this is the postgraduate time is the time they are getting married. Some of them are getting married. I have had students, who were facing divorce problems. And, I have had those students come to my home, and I have spoken in length. I have spoken with the other party also. So I have done all these kind of jugalbandi with the students, because this is the period where, they face a lot of mental issues. Apart from the curriculum being so intensive, that is one aspect, dealing with the curriculum, dealing with studies, dealing with thrice a week emergency. That is just one aspect. But when the personal problems add to it, then there can be times when they break down, depression, and then you're dealing with those students.
In fact, one thing I will tell you that all these students who are there, they are doing very good. They all were very intelligent and they are doing very well now in their professional careers. That it never affected their proficiency or their knowledge. That is what I can say. So, and we also feel, very happy that they are doing well. That is all.
Mathur sir, any message, take-home message you want to give to the students?
Yeah, before I give the message, I want to raise a query. Okay. Now, I often hear from the current teachers in the medical school that the students don't come, even residents. They bunk the PG teaching sessions and all that because they have to attend the NEET coaching classes. Okay. This is common complaint for the undergraduate, but even for the postgraduates, these type of complaints are there. On the other hand, if I talk to the students, they give the different version. So where is the problem? Because we know that needs are there. Their question, the answer expected from them are different. On the other hand, as a teacher, you want to train the residents in the clinical science, right? You want them to become a good clinician, right? Or good surgeon. So is there a disconnect between the NEET papers and what is actually expected out of them to become a good clinician? I just want to ask 3 of them, then I will make the comment.
Sir, earlier it was quite MCQ based. It was more of just epidemiology. The rate of this thing should be how much. What is the? But now, as we are improvising, we are giving clinical scenarios. in these NEET exams. But still, the clinical scenarios are not that many. If we put everything like as clinical scenarios, and that is a time when they will start valuing the teaching what it is being done in the wards. Because a PG NEET, what they do is now they have started putting clinical scenarios, but that was after a long of persistence. But initially, the PG NEET or any NEET exam, even if it is most of MCQ, rate of appendicitis in this population, how much. So they have to read, that is mugging up. They are not doing anything. On the other hand, if you have a clinical problem, a patient comes to you with vomiting after food, 2 hours after vomiting, non-bilious. So all these things, and what are the electrolyte balance at this. So that is something which is, when those people who are designing PG NEET, they will have to take into consideration those things. Now, there is little improvement, but still in exams, I will say the clinical based questions are only 20 to 30%, and the rest 70% are still the other type. Which unfortunately, that is the reason that as you said, absenteeism in the class, in the PG classes or something like that. So unless we make completely case oriented studies in the PG NEET, that thing is going to be there.
Yes,
And
here,
I think we are also not uh, good teachers as our teachers. Like our teachers, they had a benchmark. We always used to emulate. We want to be like teachers like you. Like, are we teaching to that level? That also is something which, that interest, that thing, okay, why it is happening. You have to always ask why. So that is something which, unfortunately, is missing.
yeah, may I
Yes, ma'am.
say something?
Yeah.
Actually, what Dr. Bakshi is saying is that I fully agree with him that in these NEET examinations, the students have to answer a lot of information based questions, and they feel that clinical classes are not helping them. Now, the root of the problem is that nowadays the student is not into the thing that he or she is doing. When he is doing MBBS, he is thinking, I have to get into MD. When he's doing MD, he's thinking, I have to get into DM. So everything is just a stepping stone for him. He doesn't want to, I don't know what is happening. Like, he's not trying to learn what he is doing. He is looking at the next best thing that he is going to do. Maybe that is the problem, and that is why he's into all those MCQs. And those examinations are exclusion tests. So they don't want to include more people, they want to exclude people. So they will give questions which will not be taught in the to everybody. Like, they will give questions which will trick them. So that is the utility of all those coaching classes, where they are dealing with a lot of peculiar facts and figures which people have to memorize to get through. So the problem is many tired. That is what I feel. And it will be good. People will get into clinics when they know that once I learn the clinics, I will be a good specialist doctor.
Yeah.
And we will have specialists who don't have tunnel visions, because I myself am a physician, and I often find that my students who have gone into subspecialties are giving opinions which are very, which has a very tunnel vision. They are not looking into the bigger picture. They are only saying that I know this, that this nephrological part I am opining, now refer the patient to the cardiologist so that he can give an opinion on the heart.
Yeah.
So this is unfortunate. But this is what is happening.
So basically, that means somebody is at fault for creating this system.
Yes.
And who is at fault? See, the questions are set by who?
Us.
Out of, yes. Okay.
Yes.
Who is making a policy? NMC.
Yes.
So that means we are trying to emulate US system, but not actually emulating it, because there it is all case-based, clinical case scenarios based.
Yeah.
Yes.
That's why those students there, they don't mug up anything. Okay. And that's what is our aim. that students, instead of mugging up, they understand and then analyze and then say, okay, this should be the answer for this situation. If the patient has got electrolyte imbalance, this is what is going to be the treatment, and this is how you will calculate the sodium deficit or potassium deficit, how will you give it, right? So that means there is something wrong with the system for which we are blaming both the teachers and the students. And which is the system? System creation, that is NMC.
Mathur sir,
That-
now if
Aha.
you see the NEET questions, it is not like that. It is very clinical oriented, sir. Very clinical oriented. All those epidemiology and all those kind of things have
Yes,
gone.
Yeah.
it is
If that is
Almost
as
so, then the
important
ward
as
side
80%
learning
of
should
the
be good enough
question,
to answer the question.
all clinical.
If they are all clinical, then the bedside clinics and the case-based discussions in the ward should be able to answer all those queries. Why there need tuition classes? Means, I think it's a blot on the whole medical profession to have the tuition classes for any entrance, whether from UG to PG or PG to super specialty. This was phenomena only for 10th and 12th standard. We have degenerated our medical profession, education, to that extent where the students have to go to these tuition classes. So if that is so, if most of the your NEET questions are where the 80-90% should be like that, so that they can score. Even if it is 50%, that this percentage, that percentage, and this length and that width and all that thing has no much meaning.
So I'll tell you the answer for this also.
Yeah.
These classes I don't know how they get the questions. Every year when the NEET exam is done, somehow they get the questions. I don't know how. They have some method of getting the questions. And when, supposing there is a next NEET, 30 to 40% overlap, repeat questions will be there from the last 5 years. 30% at least. So these students go over there because those questions are given to the students to solve. So that is one of the reason why they all go to classes, because they get those questions. So definitely 30 to 40% of what they have solved will come in the next NEET exam. So it is not a surprise for them. So, I mean, I think, and also when you pay somebody, no, sir, the commitment will be little more. So when you're paying 1.5 lakhs or something, then you feel committed, then they will do 250 questions per day. They will do it. Otherwise, they will be on the screen all the time. So maybe because of this, I mean, what you're saying is right. We have not gone through all those things and we have come out as good doctors, but the present cutthroat competition is pushing them like that, sir. I can't blame them for that.
So that means the system has to be rechanged. The NMC has to be told, the people who are advisor in the NMC has to be told that don't live in the ivory towers, come down to the ground reality. You have degenerated the medical education to a level of 10th and 12th standard coaching classes, which is not the thing you want. You want the patient to be treated with the correct way. And this is not the win which is helping us. Second thing is, so that's one, that it has to be improved or it has to be removed. Okay. So that the students come back to the classes, or you ban all these coaching classes. There should not be any coaching classes at the level of the MBBS and MS or MD level. Okay, they should not be permitted to operate. Second thing is, yes, the teachers have to change way to impart knowledge to the students as per the current standards. Okay, which should include that they should be able to answer the NEET questions as well as they become the good clinicians. So both things are required. That's what is my take-home message. That the teachers have to change a little bit. They know that if they can get the NEET questions, you can also get the NEET questions. So you start changing your way you teach them so that the NEET questions are also covered. So the students, rather than going to the tuition class, they learn in the wards itself, all those things. and they become a good clinician as well. And second, of course, the policymakers have to be, they have to be also apprised of all these problems which are coming.
So, ma'am, any more take-home message for the teachers per se to in this era of the changing relationships? Would you like to give?
Maintain a communication. Maintain that communication. Very, very important.
Nandini, ma'am?
Absolutely, as ma'am says, that it should be a two-way process so that we can both learn and improve.
Bakshi, sir?
I think improvising from teachers, considering the recent advances, you have to improvise. Your teaching may stay the same, but you may have some other methods of communication. You're improvising. Like if you're taking a lecture, you can just at the end of the lecture, normally what we do is we put 10 or 12 clinical based scenarios and MCQ, so that that the student gets oriented. Okay, these can be the questions, because that will attract the students. Because if at the end of the lecture you put this 10 MCQ clinical scenarios based, that what you have taught, suppose whatsoever I've taught gastric malignancy, so whatsoever. On that basis, if I'm putting some case, clinical scenario and how will you diagnose and this thing, that will help us a lot.
So I can see the chat box and all of them have actually agreed with Mathur, sir, that the exam patterns keep on changing. The teachers also need to improvise about it because there's a lot of stress on the system. So I would take this opportunity to thank all the panelists and Dr. Ashish for making this session a good thinking point from the teacher's perspective. So one take-home message to the student: make use of your mentors to their best abilities, because they have so much to give. As we can see in our teachers, that they have so much to give even after we have passed out from that institute. So change is the only constant. AI cannot replace the empathy and the physical touch or the clinical examination which is offered by the doctors. And the bond between a mentor and a mentee is deeply personal, should remain so, and should almost replace everything else, and would help the students greatly. We would hear from the students at some point, but thank you all for being a part of this session. And thanks to the UMANG team for allowing us to host this session. Thank you so much.
very much.
Thank you very much.
Thank you all very much.
And
Thank you.
I want to thank all of you to make me part of this young group.
Sir,
Thank you, sir.
You are as young as what you were 30 years back.
And I'm seeing all the teachers agreeing with what Mathur sir is saying.
There was a saying, boss is always right,
Boss is
We
always
had
Oh,
a
no,
saying.
no, no, don't say that.
Good night. Thank you.
Good night, everyone.
Good
Thank
night.
you.
Good night,
Thank
everyone.
you. Thank you.